Well, it's a concept that could sound a little extreme for some parents, taking your baby to a chiropractor.
Is it safe? That's the question a lot of folks are asking. Dr. Bryan Schuetz is here this morning from the Capital City Chiropractic to explain why it may be okay for toddlers and even newborns to come in for an adjustment. Now, you've probably heard from folks who've said, even as adults, I don't know that it's right for me. So how do we know what's right for a baby?
Well, you know, your spine is more susceptible to injuries when you're young because your muscles aren't fully formed yet, your bones aren't fully formed yet, and you're going to start out learning how to walk, and a baby can fall over 50 times a day while they're learning how to walk. And then you got riding a bike. I crashed many times riding a bike, you guys. And then you're going to take up sports. Many kids before they're 12 years old now are in contact sports or sports like soccer where they're going to fall down a lot.
So about concussions and all those sorts of things.
So if you're going to get a concussion, it stands to reason you could hurt the spine.
Right.
So it's important to check them as soon as you can. As a matter of fact, a Harvard research study showed that 85% of kids are born through the birthing process with injuries to their spine.
But we get over
the trauma.
We get over those quickly, though, because we're malleable at that age.
Well, you say that, but then you look what happens later on in life, and there's arthritis forming. As a matter of fact, arthritis is the most common disease in the animal kingdom. It's because of injuries when we're young that don't get taken care of that heal in wrong.
You know, I think I've told you this story. My niece, when she was born, had the cord wrapped around her neck. And for almost a year and a half, her neck was like that. It was such a severe trauma. And I wonder now, if we had known what we know now, if chiropractic could have helped.
It would, you know, you never know until you look and see.
Right.
Not every baby has problems, but most of them do from that pulling and twisting motion when they're being born.
So what do we do? Can you show us how this works?
Sure, yeah, it's real simple.
Let's just walk on over here.
Oh, introduce us to this little fella.
This is Julianne and her baby Dez. And Dez has been my patient since he was actually less than a day old. So I'll show you how it works. Mom holds the baby up, and we can do this on a table or we can do it just standing like this.
I'm dying.
He does enjoy his treatment. So we're going to check his hips. He's not walking yet, so he doesn't have a lot of hip problems going on. Then I take him and just check all the way up his spine. Yeah.
What are you feeling for?
I'm feeling the vertebral motion of each segment as I work up his spine, and then I have Mama hold him. I'll check his neck for him. And I know, you know, I've examined him several times, so I know what's going on with him, but a lot of times you just hold the pressure you can comfortably put on your eyeball on the baby's neck on the segments you want to move.
Really, really light.
And then the baby a lot of times will just kind of roll his head and do the work. And see, he's done right now.
Right.
He's done. Now, are you feeling anything moving?
Oh, yeah.
Oh, you are?
Yeah, sure.
And why did you decide to do this so early in life?
You know, I've been a patient of chiropractic myself since I was 14. I also was employed with Dr. Bryan for about 4 years. And I believe in it. He actually came out with the cord wrapped around his neck.
He did.
Wow.
And right away I had trouble nursing him on the left side. As soon as they adjusted him, no problem.
Everything
was
fine.
And I've heard about little ones that had ear issues, that it helped in those circumstances.
Yeah, you know, we don't treat a specific condition, but by releasing the nervous system to work like it should, the body's flow of intelligence is better, and you're going to be more healthy.
And we shouldn't be concerned about anything. There's no...
Well, you saw what I did. You know, they're going to get much worse in the course of a day as a baby than, you know, any kind of motion that I just did. Yeah, it's just pretty much you're wiggling and seeing how the things move, and it's very simple.
Now, we should point out, this is not something somebody should just try at home. You need somebody with some training to do this. Don't try this on your own.
7 years of school and then some postgraduate work in, you know, pediatric chiropractic.
Okay. Dr. Schuetz, thank you so much.
You're welcome.
Capital City
Thank
Chiropractic.
you so
We appreciate it. And you were so good. Yes, you were. That's great.
One of the year's most anticipated movies is coming, and we have your passes to see it before anyone else has a chance.
That's right. Keep watching for your chance to get tickets to go see the movie Maleficent. That's still to come.